Hello, my name is Ruth, and today I'm going to be talking about MUA for frozen shoulder with a question. Does post-op supervised physiotherapy affect the outcome? Frozen shoulder is a well-described condition of the shoulder in which pain and stiffness may occur. There are multiple treatment pathways for such condition, such as corticosteroid injections, physiotherapy, or MUA, being MUA the one with very good results. Physiotherapy following the procedure has been advocated as a way of maximizing the range of motion, as well as reducing the failure or recurrence rate, but its effectiveness in this context is actually unknown. Therefore, we decided to create a study in order to compare two pathways for patients undergoing MUA for frozen shoulder. In Group 1, the patients had MUA only, and physiotherapy was given as an advice, either via phone or via leaflet, and this was done in an NHS setting. While in Group 2, patients underwent MUA, and they actually had supervised either therapy and physiotherapy after their procedure, and this was done in the private hospital setting. Our study is a descriptive analysis of pre- and post-operative Oxford Shoulder Scores, or OSS. We used ANCOVA tests in order to measure the effect of the physiotherapy on the post-op OSS, bearing in mind that the pre-op OSS was the only covariate. In regards to our inclusion criteria, all of the patients were seen in clinics, and all of them were diagnosed with frozen shoulder disease. And this diagnosis was done between November 16 to September 18, and all of the patients had ages between 16 years old to 8 years old. In regards to exclusion criteria, all of the patients that were seen that had rotator cuff tear on their MRI or ultrasound scan were excluded. The same way that patients that had osteoarthritic changes on their X-ray were also excluded, or if they had previous MUAs. Exact matching was done based on gender, diabetes, and primary versus secondary procedures. And this was done because such factors had previously been shown to have an effect on the outcome post-MUA. In this slide, we can see a flowchart where it's quite explicit where were the patients excluded and the reason behind such exclusion. We can see the total number of patients that were studied, and we can see that the patients are actually matched, and the number of patients we used after matching for our statistical analysis. The results behind this study was actually very positive. We demonstrated a p-value less than 0.001. We proved that the effect of the physiotherapy on the post-op OSS is of statistical significance, an increase of 3.2 points in OSS with the physiotherapy post-MUA. And also, we also proved that there was no statistical difference between the two groups in the number of reduced for MUAs, either early, less than 3 months, or late, more than 3 months. Our study, however, has some limitations. One of the limitations is the fact that Group 1, the MUA only, had multiple surgeons doing the procedure, while the MUA plus physiotherapy, meaning Group 2, had only one surgeon doing the procedure. Another limiting factor can be the fundamental differences between the patients in both groups. For example, the comorbidities, the threshold for surgery, and the motivation for recovery. Our study allows us to conclude that there was a statistically significant increase in the post-op OSS in patients that were treated for frozen shoulder as part of the Group 2, meaning they had MUA and they had physiotherapy after their procedure. The results actually suggest that physiotherapy does confer real benefit. However, despite the increase of 3.2 points on the OSS, it's actually below the clinical significant level. Therefore, in the current settings, because of COVID and our NHS being quite outstretched and the face-to-face consultations being actually a bit rare due to safety reasons, MUA and physio advice only gives an excellent outcome for the treatment of frozen shoulder. However, it is arguable that the ideal method of treatment for such patients would be MUA and supervised physiotherapy as a joint pathway care. And in times that NHS is less outstretched, with more means and more resources, that should be the type of pathway we should aim for our patients. Any questions? Thank you for your attention.